its education program for medical professionals. My name is Jennifer Searfoss, and I am the CEO of the Searfoss Consulting Group. This presentation will address what you need to know about medical identity theft and the red flags rule. This session, along with many others, is available for free through iTunes as a podcast or as a video archive on YouTube. Learn more at scghealth.com. One quick legal note. None of the information contained in this presentation should be construed as legal advice. I encourage you to contact counsel if you have questions regarding state or federal laws that apply to the concepts covered in this session. With that, let's get started. We have a number of objectives to cover in the next 15 minutes, and this includes the understanding of medical identity theft, appreciation of the wonderful red flags rule. You should have some idea of what that is, and also understanding the specific actions that your office should take if a patient's identity is exposed with an actual theft of their medical identity occurs. So what is medical identity theft, and what is the red flags rule? We'll get into the first concept I want to just refresh you on is the difference between privacy and security. And privacy, I always tease, is a bit more of a lofty concept, and security is actually what you have, the safeguards that are in place today. So privacy is this thought, this emotional concept, this attachment that information or data should only be available to those individuals who need it. To be private is something that not everybody knows about, that there are certain people who shouldn't know about it. And for example, today we don't send a full medical record to a health plan if they request for clinical documentation. But a security measure is actually the technical safeguards, and it can be software, it can be hardware, it can actually be a door, it's the lock, it's the key, it's the concept, it's the actual safeguards you have. So it can be walls, windows, locks, doors, anything that's keeping information in a place that you have control over. This also includes firewalls, passwords, encryption software. All of those types of things are what make information secure. So the concept of privacy is just the thought that we have that not all information should be available to all individuals, and security are the safeguards we have in place that are going to keep that information private. Two different concepts that you have to understand to really to get into what is patient identity theft, also known as medical identity theft. So what is it? It's an incredibly growing concept, basically a phenomenon across the United States where a patient's identity is being stolen and used by others. It's a really interesting area, and we're going to get into a little bit of the legal concepts. But right now, what I can tell you is that Florida is the hot spot. And for those of you that are watching on the video or live, the archive that I have up here is a map that's back from 2008 to 2009 done by the World Privacy Forum. They have an excellent website to check out. And they noted through a number of incident reporting sites, which include the FTC along with state reporting, that Florida by far is the hot spot for medical identity theft. But Southern California, New York, Arizona, and Texas are areas where this is quite prevalent. 3% of all identity theft cases are actually for medical services. And this is, again, it's not just about financial information. Identity theft is something I think we all understand, especially in light of some of the significant financial data breaches that have happened in the last year. But where medical identity theft goes a little further is where the information is used to access healthcare services. And again, where it gets interesting is what happens with that clinical record. So something you should be acutely aware of is called the red flags rule. And this was a rule that was proposed back in 2007. And this is where the Federal Trade Commission set out that because medical practitioners, medical providers, medical facilities were essentially extending credit, meaning that you were extending payment. Patients could pay over a period of time. Because you were allowing that, all of a sudden medical providers became the same thing as a bank. And then the concepts under the Patriot Act and a number of other programs began to apply. Well, to be honest, that caused a lot of problems because a bank and a medical provider are incredibly different, and the rules that apply to them are significantly different. But there's a number of interesting things that really are some great backstops, industry standards, when you look at not only HIPAA privacy and security, but also look at preventing medical identity theft. So while the red flags rule was actually stipulated that it would not apply to medical providers because Congress passed in 2010 the Red Flags Program Clarification Act, and it delayed the FTC red flags rules applying to medical providers, that it stipulated it only goes to entities giving loans and mortgages, specifically the banking community. The red flags rule does have some great industry standards that every medical practitioner and their office staff should be aware of. So what are those? Really, it comes down to validating an individual's identity. Again, in the concept of the FTC, this had to do more with the Patriot Act and understanding that efforts needed to be made to ensure that people establishing bank accounts weren't terrorists. That was really what this was started to do. In today's world, really it comes down to, is the person who's trying to use their health insurance the actual person that is the insured? So the requirement of photo identification or some other validation method with a photograph or some other biometric aspect to it, that is what the red flags rule really is promoting and pushing. It also authenticates what the patient's identity is. So, are they a child of this individual? And again, if it's a pediatric patient, it makes sense that you may not be able to get a photo identification of it, but again, comes down to, is this patient actually their child? There's a couple different ways that you can do that. Also, change of address requests. This is a big one that comes up, sadly, in child custody cases, divorces. It's a big issue that comes up. And validation of the address request, where you send a note out to the address that they're changing it to, along with the address that it was previously, that you're changing the address. Those are the type of things that the red flags rule says that should be done. And again, to be honest, from a medical practices standpoint, these are smart things. There may be an additional cost, but this is something that you can promote to your patients as being good customer service. So at the end of the day, the red flags rule really is asking, is this a valid person? So for example, is their Social Security number listed on the Social Security Administration's Death Master file? It's a really big question. Is the person who's coming in saying that this is their health benefit and they've got the little paper copy of ID card, are they really actually that person, or are they accessing somebody's medical identity that was a recent death? Is their address valid? Are you getting a ton of return mail from that address? And also phone numbers. Bogus phone numbers are a really big thing, too, in medical identity theft. So again, making sure that when you call for scheduling, if there's problems with phone numbers, if you're getting return mail, your systems, your practice management system should have some way to alert your staff that there's a problem and revalidate that information the next time they call in. But here's what I'll say, is that there oftentimes is a considerable amount of patient pushback. Specifically, their perception is that this is a big brother aspect. What I've found with a number of my clients is really promote this as being your way of keeping their information secure. You can usually blame it on a number of other entities like Target and Neiman Marcus, where their information, their financial information, their medical information is not only going to be safeguarded by your practice through the different HIPAA aspects that you have, but you're going further to authenticate that this really is their insurance and that they are who they say they are. Oftentimes when we have that discussion and even identify medical identity theft as an option that could be happening to them, all of a sudden patients are very thankful for the office giving them that opportunity to have information more safe and secure. So it's a conversation to have with your patients, and again, a great opportunity for you to have some marketing around it. So why does this matter? And I wanted to bring forward, this is, again, a dated story back in 2008, but gives you a feeling for how long this has been around. It's not something that's new. So this story is about Brandon Reagin, and he was an active duty Marine. He was a member of our armed forces. And he had his wallet stolen back when he was here in the United States in 2004. And what ended up happening was not only was his financial information used, but his medical identity was used. So this third party who stole his wallet, his name is Arthur Watts, he went to several hospitals, and guess what? He was treated for kidney stones and a hand injury. It resulted in over $20,000 in charges. And all of those outstanding hospital bills not only went on Reagan's credit report, But then he had a lien against his tax refund done by the hospital. Again, the hospital thought this is the person who presented the insurance. This must be who we need to go after. And further, Arthur Watts then used his military ID and driver's license to test drive new cars and then would steal them. And so where this whole thing ended up was poor Reagin, who was at the time, he was actually deployed overseas. He had all this information, this horrible information ending up on his credit report, which he wasn't here on our shores to really pay attention to. But there was actually an open warrant for him in South Carolina for car theft. So again, very sad, very interesting, and actually only was when his mother started getting notices about this that they were able to step in and have some reaction to it. But I want to highlight as part of this really what it comes down to. So now Brandon Reagin's medical record, Brandon Reagin, the guy who had his wallet stolen, his medical record now says he has kidney stones. It also says that he has a hand injury. None of those things happened to him. Becomes a very interesting question about how do you clean up a clinical record. It's one thing to clean up a financial record. It's very different to begin to clean up that clinical record. And again, why these policies actually are so important for your office to have in place so that this doesn't happen and you don't have to address these questions. So how do you even detect this? So the first thing I'll tell you is that the safeguards that you have in place already in your office for HIPAA, quite honestly, is the same policies that you should have to prevent any medical identity theft. And really what it comes down to is that the scope of what we call protected health information is just somewhat expanded. And some days I'll even argue that it already is inclusive of what's called PII. It's the personal identifying information. So this includes check and bank information, credit card information. So any of that information you should treat in your office is no different than PHI. Obviously it is, and it will be treated differently in an instance of a HIPAA breach, but why not treat it just the same? Because the moment it looks this on any record, it has the date of service and it was with your office and the name of the patient, it immediately becomes protected health information, whether or not credit card information is on it. So the best practice, quite honestly, is use the security requirements of HIPAA and the concepts behind the privacy guidelines as your minimum guideline, that floor for what your office is going to do when it comes to other sensitive information. Likewise, HIPAA requires you to have policies in place that are going to prevent, detect, contain, and correct security violations. Your policy needs to be in writing and it needs to be reviewed. So again, the same concepts you already have out there, just begin to look broader about this. Just imagine if one of the scans of a patient card was included and the date of birth was written on the printout of it and that wasn't shredded. Again, it's PHI for HIPAA, but it's also an opportunity for medical identity theft. So again, think about these things a little bit broader of not just a HIPAA security breach, but in the hands of someone else, it could actually be someone who wants to access health insurance. So things to keep in mind: appoint a security and privacy officer, training of your personnel about these requirements, the accepting of complaints, and audits. So what I can tell you is oftentimes these type of incidences do not come up from you or your office staff. Instead, they come up from the patient, because the patient's the one who's going to be like, that wasn't me who received those services at the office. So your first step is going to be to conduct an investigation, and I strongly recommend the team approach. It's not just a team of one, which is the privacy or security officer, which in a medical office usually is the same person. Instead, it's going to be a number of people. So maybe a physician involved, you definitely get your clinical staff involved, maybe a nurse involved as well, and then again, depending on your administrative setup, a number of folks from your billing office. Also plan how you're going to address that information in the patient's both administrative and clinical record. As I talked about, this is a really big deal. So now all of a sudden, let's say somebody comes in and they say that they have an allergy to sulfa. Well, if it's the wrong person, that's a really big thing. So again, keep in mind that this is broader, and if it's in your office and they receive surgical services, this will also be in the hospital office. So there's partners that need to be involved and made aware. A couple things to know about is that patients, again, when this comes up, they are going to need to file a police complaint because, again, this is actual theft. They generally should file an FTC complaint. So, again, the the Federal Trade Commission. The FTC has an entire unit that's dedicated to this. And then there's certain obligations that your office will have under the Fair Credit Reporting Act, where, again, if there's a lien or any other delinquency that's created, that you need to report back saying, nope, this is the wrong person. And then oftentimes in these instances, identity monitoring is going to go on. Depending on the scope, if it's just one patient, you wouldn't need to report it to HHS. Instead, you would need to keep a log of this and then report it at your end. If it is, again, above the thresholds under high-tech, you would need to report it. For more information on the high-tech requirements, we have several other Gimme 15-minute sessions on that. The other thing to keep in mind is, what is your office going to do to prevent more breaches? So that's the other thing just to keep in the back of your mind is, what are you going to do to prevent more medical identity theft? And again, it may just be going back to those safeguards that were brought up earlier about from the red flags rule. Maybe it is that you ask for photo identification. So with that, I want to go ahead and thank you all for joining me today. Quickly, there's a number of resources I just want to provide to you, and that includes the Bureau of Consumer Protection. There's a great FAQ for you out there on medical identity theft. The Social Security Administration's Death Master File is also available. There's a number of services that have it out there. And if you go to AHIMA's website, they have a number of resources on medical identity theft. And if you just go ahead and use your search function, you can get to all that information. So with that, I want to thank you for your time listening to this podcast or watching the video archive. And please remember, if you're able to rate this in either iTunes or YouTube. To receive notices about upcoming Gimme 15-minute programs or other educational sessions, please sign up at svghealth.com. Thank you for joining me for this 15-minute education program. This concludes the presentation.